Hi, today we're going to talk a little bit about three different gastrointestinal disorders. They're kind of interchangeable. People sometimes refer to them as heartburn or indigestion or GERD, which stands for gastroesophageal reflux disease. They're really very similar type conditions in terms of the conditions and symptoms they produce and the actual causality that we tend to have. They're characterized, of course, by the symptoms that you can read about in the attached section, but mainly burning and distension and fullness in the top part of the digestive system. The causes, however, there's about three different causes of GERD or heartburn. One of them can be a hiatal hernia. That's something that you can be diagnosed with via X-ray. You can actually see if the stomach is actually there's a tear in the diaphragm. The stomach actually slides or moves up slightly, which opens the top part of the stomach up and allows the acids to escape the stomach and go into the esophagus, where you get the burning sensation that's there. So that's one cause, and that's more mechanical than it is physiological in terms of the body. Another cause of GERD or heartburn oftentimes is an ulcer. You can actually develop an ulcer, and what we now know causes ulcers is not just a matter of stress, but it's caused actually by a little bacterium called Helicobacter pylori. H. pylori is sometimes referred at. And so you can a lot of times identify this via blood test, any antibodies that you might have to it. Certainly a gastroenterologist who looks down with a scope can see that. But short of that, a lot of times we can have other methods that we use here at LifeWorks to determine if you indeed have H. pylori. I determined a long time ago, if I find on my evaluation I feel this there, I treat it, because sometimes we get false negatives on tests. People can actually have H. pylori and not necessarily manifest the laboratory signs that comes through, so we will a lot of times treat that. But an unrecognized cause of heartburn is that related to leaky gut. Now, leaky gut's a whole different condition, but one of the hallmarks of leaky gut is that of food allergies. Food allergies cause a release of different kinds of inflammatory chemicals, among them is histamines. And these histamines released by leaky gut and the food allergies will actually trigger your cells in your stomach called parietal cells that make hydrochloric acid. It causes them to release the hydrochloric acid, and that can result in a gastritis or irritation of the stomach, particularly when there's no other food in there. Food's downstream in the small intestine being broken down and further digested, and unfortunately those histamines are released during that period, and that's what then gives rise to the heartburn and gastrointestinal distress that people have. A lot of times medically there's different kinds of medications used to inhibit the hydrochloric acid secretion, but we try and get to the cause of why do you have this gastritis, why do we have the symptoms to begin with, and it falls in those categories. Either there's a hiatal hernia, we have a H. pylori causing ulcer, or we have food allergies associated with leaky gut. Those are three things we find. We can evaluate this and do evaluate those when people come in with those complaints. Generally it responds very nicely to what we do, and again, it depends on the cause. That's the important thing, getting to the cause. Thanks.